All right, I think we're good to go.
Wonderful. Well, welcome everybody. So my name is Sarah Holger, and I'm one of the Southeast Minnesota Park RX team members. I'm a naturalist at Whitewater State Park. And Brian and Ben and Ruth, jump in if there's anything you want to add to this. I'm just going to give a quick intro to Southeast Minnesota Park RX, and then I'll turn it over to Megan. But we've been meeting since 2019, and I think a lot of us have been working on, at least within the parks realm, trying to figure out ways to connect with healthcare for quite a few years prior to 2019. And then Dr. Czar, the founder of Park RX, who's based out of Washington, D.C., came to Minnesota in, I believe it was late 2018 or early 2019, gave a talk, and that really just helped like kickstart a larger kind of regional effort down here. And I know statewide there's been movement as well. So we were really lucky to be able to get some folks from Mayo Clinic, Olmsted County Public Health, Olmsted County Parks, and Olmsted County Public Health has really been helping facilitate this and designating some staff people to help kind of coordinate our meetings. So we meet monthly and we represent parks and healthcare providers and trying to bridge the two together and really empower and kind of equip healthcare providers to be able to start having conversations with their patients and hopefully eventually start prescribing time outdoors. And so we've done a variety of different projects and piloted a few things, and we're just kind of continually trying to figure out ways to share information and resources with folks in the Southeast Minnesota region. I think that's probably a good enough overview right now. I'll pass it on to Megan.
Thank you, Sarah, for that little intro. For our presenters, Lindsay Nelson is the Health Systems Coordinator at the Minnesota Department of Health. Her work is focused on aligning healthcare organizations with community-based resources through strategies including ParkRx. She has almost 10 years of experience working in public health and has worked for local governments, nonprofits, and a federally qualified health center. She has a passion for health education and has her Master Certified Health Education Specialist to support linking education programs to larger policy, systems, and environmental changes. And Erin McHenry Wolf is the Arthritis Program Coordinator at the Minnesota Department of Health. Erin has a background in health communications. Her past work focuses on promoting diabetes prevention, management, and oral health promotion programs and services. She also worked as a public information officer for the state's COVID-19 response and is currently pursuing a master's degree in public health from the University of Minnesota. So thank you, Erin and Lindsay, for joining us, and I'll pass it over to you two.
Excellent. Thank you, Megan. So I'm going to go ahead and share my screen here. Looks like I'm going to switch it over. I just realized it popped up on the one, and I want to be able to look at you guys too. Okay. Try this. All right. Are you seeing the presentation?
Yes, it's not in like presenter mode yet, but we are.
Oh, now, of course. All right. I'm just going to go back to doing it over on that side, I guess, because it automatically went over there when I presented for some reason. So I have another screen, so I'm not ignoring folks, just so you all know. All right, let's try this one more time. All right, let's make sure. All right, is it working now?
Yep, looks good.
Okay, perfect. Thanks, Erin. So thanks, everyone. So as Megan mentioned, my name is Lindsay Nelson. I'm our health systems coordinator within the Minnesota Department of Health. And I'm here with my colleague, Erin, and we're going to talk about some arthritis strategies. I'm going to talk a little bit about exercise as medicine, and then she's going to talk about our Walk with Ease program and how to kind of incorporate the two. So I know folks on this call are familiar with SHIP. So I work out of our Office of Statewide Health Improvement Initiatives, and probably about half of my time is working with our SHIP partners across the state. So I work within our healthcare setting, and we have, I think, like 16 different activities that local public health agencies can work on. And one of our newer ones for this grant cycle is called Exercises Medicine. I know that it's a national program, but we're really just kind of encompassing all things related to exercises medicine. So we have Exercise RX, Park RX, looking at the screening pieces within that. So I'm going to talk a little bit about what that strategy looks like and how it kind of can fit within this arthritis work and Park RX work that you all are working on as well. So we really focus on those clinical community linkages. And within this strategy, really focusing on that healthcare piece around screening, counseling, and referrals around physical activity. So essentially within SHIP, um, local public health agencies will partner with healthcare settings that will in return partner with community partners to really create that clinical community linkage and essentially prescribe patients to various resources around physical activity. So looking at exercises medicine as a strategy around Park RX work. So I pulled this from the American College of Sports Medicine, but physical activity is an effective prescription for management of over 40 chronic health conditions. So it's something that can really be tailored for a lot of folks within the community that are coming into their healthcare systems or clinics for visits. And what we're really looking to do is focus on that systems level approach to create sustainable change. So we really want to make sure that this can be something that is created as a standard of care and can really be utilized within different types of visits at the clinic themselves. And as Erin's going to talk about here shortly, this really overlaps with some other current strategies across public health. One of our other strategies within SHIP is working on healthy lifestyle change programs, which can include Walk with Ease. So I think there's a lot of different connections that can be made within the screening piece at the healthcare centers and then the referrals to these other programs within the community. So exercises medicine can really look different in each community. Within our SHIP work, we kind of called out a few programs, but this is not in any way limited to ideas that folks might have. So we were looking at Park RX, Exercise RX, and then physical activity as a vital sign as three kind of national programs that we have resources for and have shown to kind of provide those outcomes that we're looking for. So I'm just going to kind of break those down a little bit more. But like I said, this can look different community to community. So nothing's off the table by any means. So within these examples, so Exercise RX is really looking at that physical activity piece. It's collaboration between healthcare providers and community partners who are providing those physical activity programs. So providers essentially screen patients and then prescribe physical activity based on recommendations. And I put here too, this physical activity as a vital sign is essentially a screening tool, so it can be incorporated between both Exercise RX and Park RX as well. And I think there's so many different programs around this work. So folks are doing it differently, whether it's connecting with their local YMCA, connecting with their community centers. This can also, of course, be linked within some parks programming as well. So it's just one of those good examples of how the healthcare community partnership can look. And then as you all are very familiar with, Park RX is our other strategy that I know quite a few SHIP folks are currently either working on or have implemented Parks RX programs across the state. But of course, looking at collaboration between park and public land agencies within healthcare providers and then community partnerships as well. I think what's nice about this one too is aside from Exercise RX, which is really focusing on that physical activity piece, this also can look at that mental health aspect and just taking time in nature. So within SHIP 2, we just kind of launched a new focus around well-being. So it's something too that it doesn't have to solely be focused on the physical activity piece. Maybe it's just saying, hey, let's get outside for a little bit. Here's a local park that's in your area. So there's kind of some crossover between that physical and mental health piece as well. But as we all know, of course, physical activity does help with mental health as well. So Yep, very similar to Exercise RX. It's essentially prescribing time outdoors and then providing those park locations. So those are the two kind of pieces that we're looking at through SHIP. And then I did want to touch on the physical activity as a vital sign because this really incorporates that screening piece for folks coming into their clinical visits. So it's an evidence-based tool. It's essentially just two questions. So looking at how many days per week folks engage in physical activity, and then how many minutes. So they can utilize this screening tool, whether it's incorporated into that EHR system directly. They also have some resources that are like printable pieces too, depending on the capacity of the clinic. But those are the kind of two set standard questions that can be asked to lead into the counseling and referral pieces. So then I'm going to quickly run through these. This is also included in our Let's Walk Minnesota toolkit, which I have a link to that once I wrap up here. But just kind of talking about the step-by-steps of what this might look like in a clinical setting, all the way to that referral piece. So within this toolkit, it addresses the 5 A's. So ask, advise, agree, assist, and arrange. So essentially taking that screening, counseling, referral, and just adding a couple pieces in between. But this is really effective with kind of that patient-centered discussions and looking at that organized system of care that I mentioned earlier. So the first one, looking at ask, this is where that screening can also come into play. So really that baseline touch point of determining whether this is something that the patient will A, be interested or B, needs. So looking at those goals and messaging around why this is important, and then moving into advising. So this is really looking at kind of those check-ins with patients. And what's nice with the screening tool is this can also be an assessment to kind of recheck as folks come back in for appointments. So really ensuring that they're taking this assessment that they originally did with the patient and kind of checking in to see where they're at. And I think one thing to make sure is that this patient is also ready to make a change. So that's kind of where this advising piece comes in as well. So then once a provider kind of has those discussions, this is the next step of kind of that goal setting and agreeing to move forward with that prescription or referral piece. And I want to say too, this doesn't have to all fall within that provider, because I think that's one thing that, so I used to work for Scott County Public Health, and we were in the midst of just launching a Parker X program before COVID hit. But I think that was one of the major discussion points that we were having was these providers, they don't have a lot of time with patients. So if you're able to kind of loop in the entire care team, whether that's connecting them with a care coordinator, or maybe there's a community health worker on staff. Maybe it's doing the assessment in the waiting room, having something there that they can just bring in. I think there's different pieces that clinic systems can look at to see how this might work within their specific community and clinic. So this agree piece is really just using those motivational interviewing skills to set goals. I'm sure as you all are aware of SMART goals and goal setting, but there's other resources available in that toolkit as well. And then the last two are really focused on that referral piece and getting what they need set up. So this is kind of having that discussion with the patient, and then looking at if there's a referral to a community organization that might have an evidence-based program they're offering, such as Walk with Ease. But also maybe there's something on site or within like ParkRx, kind of just doing the basics of getting them knowing how much they should be doing physical activity or walking and what that might look like. And like I said, the assistant arrange can kind of look at that referral piece, but this also includes that follow-up to ensure that they're feeling supportive if they have any questions. So anytime they come back for appointments, or if there's a way that you can reach out by text, email, or phone call to follow up with them, just making sure that they're supported within that decision, and even just made that initial contact with the program that you referred them to. So like I said, I wanted to include just some resources here. I know you all are very familiar with ParkRx and ParkRx America, but I included a link to the partner toolkit. So I can also send these slides along that you can send out to folks as well, Megan. I included the Exercises Medicine website that has really good information about some of those screening processes. And then the actual screening tool itself, I linked as well. So that's what I have for my part, and I can pass it over to Erin, who's going to kind of talk about more specifically the Walk with Ease and the tie-in with arthritis. So,
Yeah, sounds good. Thank you, Lindsay. Well, it's wonderful to be here. Thank you all for having us. I don't have a slide on this, but before I kind of dive into my slides, I just wanted to share a little bit about arthritis and why we're why we're focusing on that. So we have about 1 in 5 adults in Minnesota has arthritis. Oftentimes when we think of arthritis, we think of someone who is older, very frail, maybe in a nursing home, but about 40% of folks with arthritis in Minnesota are in the 45 to 64 age category, and even 14% are in people 18 to 44. Obviously, there is a lot of arthritis prevalence in older adults as well, but I think that's helpful context. It's also tends to occur with other conditions. So 1 in 3 Minnesota adults with a chronic condition also has arthritis. So like folks with diabetes, high blood pressure, obesity, often also have arthritis. So if you want to go to the next slide, Lindsay. Physical activity is a great way to help folks with arthritis manage their pain. That is sort of kind of where we're heading with this, but obviously we know that physical activity is helpful, as Lindsay mentioned, with 40 different types of health conditions. It also can improve function, flexibility, and balance, reduce falls risk, which we know falls can be very costly. As you know, Sarah is working in her area, it can help with mental health and boosting your mood, and just improves overall quality of life. Next slide, please. Okay, so this is some fun public health jargon we've got here. I'm focused on arthritis appropriate evidence-based programs. What that basically means is classes that people can take to help them get active. We're thinking about low impact aerobic activities. So something that's getting your heart kind of going, but it's not going to result in such pressure on your joints, so it's maybe not running, but you could do walking, cycling, swimming, yoga, etc. In my work, we're funded through the Centers for Disease Control and Prevention, and there are several different programs that have been approved that are arthritis friendly. That does not mean that these programs are only for people with arthritis. They are great for someone from any type of walk or any walk of life and any type of disability. Some of them also have some interesting, adaptations that you can do to help be more inclusive for other types of abilities as well. So there's a lot of words there, and I understand that. I'm going to share a link with everyone for later, but it's just kind of to show that there's a lot of different programs available. I'm mostly going to focus on talking about Walk with Ease today, but I wanted to share this because there are so many different programs out there that, we could be finding ways to integrate into something like a ParksRx initiative. All right, next slide. Oh no. I also just noticed that, I shouldn't call this out. Maybe no one would have noticed. There's like a tagline filler at the bottom I didn't complete. Sorry, everyone. Human mistake. Okay, so Walk with Ease. This is a 6-week walking program. It was designed by the Arthritis Foundation for people with arthritis. While it's designed for people with arthritis, it is not limited to that. People, as I mentioned, from with other conditions or who don't have a health condition have found it also to be beneficial. There are 2 formats. You have a self-directed, and then there's a group format. As part of this, everyone gets a workbook, and then you go through sort of health education modules in this workbook and go on walks 3 times a week over those 6 weeks. So the group, well, actually, I'll take a second here before I jump into that. The program has been studied and it's proven to help reduce arthritis pain, increase balance, strengthen walking pace, building confidence in the ability to be active, and improve overall health. And I think the building confidence and ability to be active is a good one, because something that we find, especially with arthritis or people who have joint pain, is that they're scared to get started being active. They're scared that they might fall. They're scared that it will be more painful, that they're not strong enough. And what we find is a lot of times when you aren't being active, that's when you actually are more likely to become injured or have a fall because of that loss of strength. So that's really great because it gives folks the ability to try and, have more activity in their lives. Next slide, please. Okay, so I mentioned there's 2 formats. The group format is a group cohort model. You have about 10 to 15 people per group. You're generally going to meet for about 60 minutes, and that would be about, maybe 10, 20 minutes going through the workbook, doing maybe some stretching, and then going on a walk as a group. The requirements to offer this: you need to have a leader. They have to complete a training. It's online and on demand. It costs $89, but something really nice is there are no licensing fees. If anyone is familiar with something like, the Chronic Disease Self-Management Program or Enhanced Fitness, sometimes that can cost like thousands of dollars to go through the training and then to continue to offer it through the licensing fees. So that's kind of nice that it's lower cost. Your leader needs to be CPR certified, and they recommend you have first aid training, just because if you're out and about with folks going on a walk, that could help out if something were to happen, but it's not a requirement. And then the only other cost is the workbook. So you can get the print workbook for $11.95. If you get a digital workbook, it's about $5. So that's just an ebook that you can access on like a phone or a tablet. It's also available in Spanish. And one thing that some programs have started to do to try and eliminate the recurring costs is they will get a set of workbooks and use them more like a library system, where they're loaned out to the participants and returned at the end of the program. Okay, next slide. Okay, so then the other format is called the self-directed Walk with Ease. In this format, it's all self-paced. So you would go through the workbook on your own, you go on walks on your own time, and you don't need to go to like an in-person group gathering. Sometimes the group format is really nice because there's more of that social connection, which is really beneficial with, thinking about mental health, isolation, things like that. So we do recommend sometimes that you have a coordinator, and this is someone who can check in, see how things are going. Maybe it's just sending an email once a week, maybe sending out motivational messages, check-ins, tips for walking. We do have, Lindsay mentioned we have a toolkit earlier. We have a lot of marketing communications materials that are available in that you could use if you were offering a program like this. One thing that is kind of unique about this program, we have a online platform called, you can see the link below, it's startwalkwithease.org. You use /Minnesota, you'll see our portal system. And I have a slide in a little bit that I'll show you kind of what that looks like. So if you go through this program, you can set it up directly through our portal. And so how that works is participants will go to the website to create an account and order a workbook. Getting them the workbook is all figured out through the portal. You don't have to do that. And then if another nice thing is that there is built-in motivational messaging, check-ins, and content built into the platform that has like videos about, here's some places you could walk, or stretching tips, things like that. And then the other nice thing is that it captures their data. And so you can get some de-identified data on, how people have changed over time in terms of, increasing their walking. I feel more confident in my walking. We do have a question that asks about like mental health and feelings of loneliness, which is, I think, helpful when thinking too about Parks RX work. All right, next slide. Okay, so this is the page that you'd see. It is a little confusing. It's not the most user-friendly, but essentially what someone will do is they'll put in their information, they create a username and password, and then we'll go through to sign up. Towards the bottom of the page, you'll see there's a little section that says group, and you'll see self-directed, and then you see step 2 at Hennepin County. We can work sometimes to create a special subset or group that people can enroll through. That's kind of nice when you have like maybe a larger group, but we want to do something specific. And then what is helpful with that is not only that everybody's registering through this at the same time, perhaps, but you also, again, can get that data. All right, next slide. Okay, so I just want to talk a little bit about how we Lindsay and I have also gotten connected into this work. We're working with Ariel and Sarah, who are on this call. We want to try to promote the Walk with Ease self-directed program as part of the monthly mental health well-being walks that Sarah is leading at Whitewater State Park. So as part of this, it's thinking about, we want to promote walking, we want to promote time in parks. There's a great overlap here. As part of this, our hope is to encourage those who participate in the walks to then create an account and go through the Walk with Ease program. We're also looking into trying to plan another provider day that Sarah and Ariel worked on back before COVID, into talking more about some of this overlap. Slide, please. Okay, so to close out, we actually have some questions for all of you if you have time and interest. As we're kind of doing this work and we are planning, we're trying to think a little bit about what communities we might want to engage or who we might want to have a special focus. As I mentioned, Walk with Ease is designed for people with arthritis. We, of course, want to try to reach folks with arthritis, but it is not a requirement. So we don't want to be, I guess, closing it off to just that community. Another question we had is just thinking about what sort of connections exist that could help us to recruit for this. If there are ideas about doing something like another provider education day. What sort of social barriers we might want to consider and how we could address them. So we've thought about maybe we would offer transportation, but then thinking about, would this be helpful? Is this something that, is there clear places where it would make sense to stop and pick folks up? And then lastly, we have a couple times picked out that we thought might be a good time to do this provider education, and just wanted to see if anybody has any reactions to that. I know that's a lot that I just asked you in like 30 seconds. I don't expect to have immediate answers, but I just kind of wanted to go through that before we pause and open it up for general questions as well.
I know, this is Sarah. I know when we had a brainstorming call last week, thinking about like potential partners in Southeast Minnesota that we could help work with them to help promote this opportunity, these well-being walks and this Walk with Ease kind of partnership that we're going to try. I was thinking like physical therapy organizations, because I know there's like active PT, like there's these different nonprofits and such around the region that do that work. But I'm not a healthcare provider, so I would refer that back to the healthcare folks. Like, what do you think might be programs that already exist or organizations out there where this might be a good fit to share the information with them and try to work together?
Yeah, this is Brian Lynch from Mayo Clinic, and these are great questions. And I think at a place like Exercise Abilities or Active PT, for example, in Rochester would be great places that promote a lot of physical activity. I think a lot of the private organizations that do mental health care, this would be great to connect them to also. So I think those would be opportunities that maybe we haven't reached out to in the past that could be outstanding. And I think this could be really beneficial. And that's maybe one that hasn't been reached as much about information about ParksRx as a whole. In terms of the question about provider days, I mean, I think it's difficult, at least for, when we've tried for the Mayo Clinic MD providers to try to get good showings on a specific day, per se. I think like having more information available of providing it, I think is helpful. I mean, it's past COVID. I think we could give it a try, but I guess my impression of sort of engagement, right now, there's just a lot of burnout with providers, and I think I'm not optimistic that we'd have a great showing kind of in, at this time. I'm hoping that changes, but I think I don't see a lot of people taking on extra things. I do a lot of different grant stuff for like the state of Minnesota and across the country. And there's just people who I think we used to get a lot more applications for a lot of these, or mainly kind of extra things outside the clinic. And it's way down like across the country, at least with MDs and medical providers that I'm working with. So it's really unfortunate, but I think it's also something to consider in what we do. Who would we reach? How do we reach them? In terms of the social determinants, I mean, we had planned a few years ago maybe to take a bus to the YMCA and maybe take families down. That I thought was a great idea on the weekends. The YMCA is closed in Rochester now. There may be an opportunity at Gage East. Pastor Andre Crockett is putting together a new youth programming for mostly middle school and high school kids. Many of them probably who have not, explored the, state parks. So that could be a possible avenue I could explore. Like, could we bring a bus there on a Saturday, take families down for free, take them to Whitewater, do something, bring them back. Could be something I think that he would be interested in. I'm happy to talk with him about, and that's kind of a new opportunity. It's just kind of opening up though and starting. So I'm not sure, it may be a little early May for that, but maybe, you know, come the fall or something after they get programming going and kind of get more interest, you know, could be good. So at least those are some of my ideas.
Thank you, Brian. That's really, really helpful. I appreciate all that insight. To your point about just, you know, the burnout, which we've seen too at the health department, do you think there would be interest in like webinar opportunities, you know, even like a 30-minute lunch and learn or something like that? I know webinars can also be a little overwhelming, and you're getting hearing about them all the time from all sorts of different angles. But I'm curious if you think there would be any interest in something like that. Obviously, you're not going to get folks out into the nature, right? But could introduce the idea.
Certainly a better chance. I mean, the ideal is if this could be, you know, something integrated like into our medical record system, something, you know, for example, if I make a referral right now to a private PT agency in Rochester, I can do that through the medical record. I can't do that for Parks RX. I have to go essentially a separate site. I think anything, you know, we're working on social determinants of health screening and referral, and essentially involving community health workers, you know, involved a lot with that process to do like the referral. And that's taking off, although not as quickly as at least I'd like to see it taking off. Like you kind of alluded to, I think it works best if there's that infrastructure there and there can be that, you know, movement. I think the challenge is, I think we are, I mean, at least most of the physicians I talk to see the benefits, but then they have to balance with maybe things they have to do, you know, maybe for asthma care or diabetes care that's being tracked and reported statewide. So a lot of the initiatives done at medical clinics focus on those kind of things. And it's really only the people who are self kind of motivated or want to take something on that really kind of do things like Parks RX or take time to talk about the parks. And, you know, I don't know. I think it's going to be some time before it can be sort of an organizational priority for large organizations, which is, I think, is what it would take really to kind of really move it forward. And I don't know. I don't, you know, I'm certainly on a lot of committees that keep bringing this up. I do a lot of obesity work. You know, I can talk again I think this Wednesday, I have a meeting with all the sort of obesity intervention leaders at Mayo Clinic, and I can bring up again the Parks RX, and if there's, you know, ideas or connections or people, so that could be, I think the mental health and obesity kind of angles to kind of find the people doing most with that kind of make the most sense right now. At least that's my thoughts. I wish I could say otherwise. I think the pandemic's been hard on medical providers through public health and medical clinics, and I do think we have to think out of the box to try to reach how families can be reached outside of the medical system, you know, the schools, the public health, you know, as much as possible in the short term.
Yeah, that's nice to hear that. I mean, like I said, prior to starting at the state here, I was starting to have conversations with providers, but even pre-pandemic, it was a push. So I definitely understand the just capacity and what that looks like. But I think Sarah, did you have your hand up first, I think?
I was just going to ask Dr. Lynch his thoughts on what if this was framed as self-care for the providers? And, you know, you're talking about burnout, and I know this is a high stress, probably a high trauma field to be in. What if it was framed as this is a self-care opportunity for providers to experience, you know, a nature-based walk and learn a little bit more about, you know, I guess kind of the stuff we talked about at the first Providers of Parks Field Day. The feedback we got from a lot of those providers was, wow, I didn't know these parks were here. I mean, there's no way they can go on and prescribe time outdoors very effectively if they themselves aren't having that relationship with nature. Plus, I think everybody could benefit from this. So I don't know if it could be framed that way, if there's a program even through like some of these clinics where it's self-care for the employees that we team up with and start with that, maybe, I don't know.
Yeah, I mean, there is an employee like support system like at Mayo, and I'm sure a lot have that. For example, you can kind of go as an employee, you know, and you're having like mental health concerns or other kind of job stress and meet, and maybe it would be good to let those groups kind of be more aware of this, and then potentially to promote that. So I think for some individuals it would work. I think for the idea of really trying to have an encompassing day, I mean, I think it would have to be something more like, you know, a department leader says, you know, we're sensing burnout. We think this would be good for our department. Let's have a day where we have, I mean, that's where we'd be successful. You know, I think from more the top down, as someone's saying, I think, you know, unfortunately, I think we kind of have to wait a little bit till people, you know, that kind of comes up. I don't know, you know, and then react to it more. You know, I think a proactive kind of list the day, and on May 6th, you know, you can come out, and I just don't think we'll probably get a lot of turnout through that. Although I think it would really benefit a lot of people.
Jessica, do you want to chime in?
Yeah. So, I mean, like Dr. Lynch said, I think it's finding individuals who have kind of a passion for this. So I worked at the Casson Clinic probably 6 years ago, and that's the residency program. And we had a resident who had a very high passion for public health and wellness. And she engaged the public, you know, she would do kind of the RX for movement and started like the walk with a doc. She would hold like community, you know, engagement things, and it was like walks and yoga. So I don't know if you've partnered with residency programs, because I know they're very busy, but typically in a residency program, they have projects that they have to do. So, you know, it was really successful when I worked there. So I don't know if that's something you've explored.
Yeah, that's a great idea.
Yeah, that's
So, you know, we haven't done anything with that, at least with Walk with Ease, you know, which is what I'm coming from. Obviously not necessarily Parks RX, but I do know we have worked before with nursing students on the diabetes prevention program, if anyone's familiar with that one. And I know that they had a lot of success with that, but I think that's a really interesting approach that would be great to consider and could have a lot of sustainability in terms of, especially if you're able to work it into kind of like the program, it's the residency program itself, or, you know, a student training program. It can keep going, you know, every year. So I think
Even
that's a great idea.
capstone, you know, capstone projects for nurses who are trying to, you know, get their NP or just their master's. They usually need a project as well. So, or the SIP program, we have a lot of nurses going for PhD programs who have to do a research project. So I feel like if you could partner with an individual who has, you know, a really high desire.
Yeah, and I like the idea too, like you said, kind of finding that champion and almost even approaching it as like a pilot to kind of see what those outcomes look like with even just one provider, if it's residency or student led. I think that could be really beneficial to kind of start that discussion, at least within a system, to maybe lead into kind of those smaller changes to ease the capacity issues, I guess, too. So I really like that idea.
Yeah, I really like the idea of reaching out to residents too. I've recently had some discussions with the pediatric residency program leadership at Mayo about like more community engagement opportunities for residents. And I could see this as perfect, you know. we could do two things at once. We could bring the residents out for a day kind of for their mental health, but then they would learn about parks, our action opportunities, and hopefully then they could be referring patients, and so I will reach out to them about this and see if there's interest.
That's awesome. Yeah, let us know. So another question, so we've there's sort of two pieces to this, right? So we kind of are thinking, how can we do some of the provider engagement? We also have these walks that Sarah's holding, and thinking about trying to use that also as a way to then encourage continued walking through the self-directed program. Just kind of wondering if folks have any thoughts about specific communities or groups to try to recruit, for those, or maybe not recruit, but just to promote this opportunity, like these forest bathing walks. One idea that we thought of was maybe trying to promote like grandparents to come with their grandkids. Or I think you mentioned this, Brian, just like trying to get families, sending them out. Ruth, yeah, go ahead.
Have you thought about collaborating with 125 Live here in Rochester?
I don't know what it is, so I'd love to hear about it.
So 125 Live is, I don't know the best way to put it. It's an exercise facility, but it's really for people like over the age of 50, 55. And I know they have, when you go out and look at their website, they have like very specific exercise classes for arthritis and different things like that. And that might be an opportunity to tap into kind of that age group, like you just mentioned, grandparents bringing their grandkids, things like that. That might be a good start. I know you had mentioned Active PT earlier. I absolutely love the place. Speaking from someone with lots and lots of arthritis and 2 knee replacements, I have been there multiple times and it's a great crew. But it might be something, even if you had flyers, that you could work with the therapist there. And if they have a patient that they think it would, benefit, it might be somebody that you could connect them up to.
I can add to that too. We have worked with Rochester 125 Live. We usually do a couple programs a year out there, and they're great organization to work with. And then also, it just popped in my head as you mentioned that, Ruth. RCTC has like an adult continuing ed kind of senior university program, and I'm going to be teaching a forest bathing class through that. I didn't even think they have a whole network where they reach out to older retired folks for kind of continuing education. So maybe that's a way to get the information out as well. And Winona State University has a similar program. So there's other places we could share the information.
And I just saw an advertisement scroll across my screen as I was looking at stuff. I think Shorewood also has a exercise facility, and I couldn't really tell from looking at their information, I didn't dig real deep, whether that was only for residents of Shorewood or if that was something, quote unquote, if you meet the requirements type thing, that you could join it. They had something on their website, but like I said, I didn't dig into it real deeply.
They're all wonderful ideas. Thank you all so much for your input. I know I'm seeing we got about 10 minutes left. So Megan, I don't know if you want to take it from here or if there are any other questions or comments.
think we'll open it up if there's any other questions or comments, and if not, this is recorded, so we're going to be posting it on the Project Get Outdoors YouTube page under the Southeast Minnesota section on there. So if you want to share it with friends to help get the word out, please do that. And then it will also be on the ParkRx Facebook page too, with the link there.
Great. Well, thanks for having us.
Yes, thank you for coming. So if there's no other questions, then we'll wrap it up. But if there's other questions, feel free to answer those since we have a little more time. All right, well, thank you, Lindsay and Aaron. And like I said, feel free to share this. And it sounds like we had some good conversation going. So thank you for joining us. And we'll keep everyone posted for our next speakers.
Thank you.
Thank you.
Thank you.